Okay, everyone, let's go and welcome to our webinar. I'm Brad Keats from the Innovative Technologies team at Canada Health Infoway, and I want to welcome you to the first of our 5 webinars we have on implementing artificial intelligence in the healthcare setting in Canada. By the way, we're not quite yet for the next slide. We just moved back. By the way, we just started an opening poll. Hopefully, you can see it on your screen. If you could take a moment just to answer a couple of questions there, we're really interested in your experience and your background. Infoway soft launched a toolkit related to the webinars that are coming up in the middle of December. They've been quite successful in terms of reach going on, and these webinars reflect a lot of the content that's in the toolkit. There's a link on this page. Look at those toolkits as well. Move to the next slide now. Now, as I mentioned, this is the first introductory webinar that we have. It'll likely last half an hour, maybe 35, 40 minutes. We're hoping that there were a few questions, but I want to make sure that you know that there are some really specific webinars coming up every Thursday from 12 to 1 o'clock Toronto time. On the 10th, the 17th, the 24th, and the 3rd. The seminar and webinar on the 10th is about emerging regulation of AI, really a survey of some of the artificial intelligence regulations and laws across the country. Some of them are really fresh and quite interesting. Others are catching up. It's a really comprehensive piece that we've got going on there. The 17th is about understanding the fit of your organization and where they are in their own, I'll call it innovative technology, artificial intelligence journey, and some of the things you might want to think about from a identifying opportunity perspective. The key risks part of this turns out to be one of the more popular models. And when we looked at how we developed the toolkit and we developed the webinars, a lot of it's about looking at these toolkits from a governance perspective. You'll see a lot of that content there. And then March 3rd, my particular favorite module, although all of them are fantastic, we get into some really specific areas, how to approach things like algorithmic explainability and how to analyze the data from a bias perspective to make sure that it fits. So there's a fair bit going on there. Before we get started, I wanted to just mention a couple of things. First of all, this webinar is being recorded and will be posted to our website. We will not be posting the list of participants, but I just wanted to make sure that you knew that this webinar was going to be recorded. If you have questions, if you could ask them in the Q&A part of the Zoom, that would be great. But there's also a chat feature if you just want to contribute. I think that would be great as well. I'd also like to remind you that this is available with simultaneous translation into French. And if you click on the interpretation button and then click on French, you should be able to get the French translation. And one more thing before we move on. Due to the nature of some of the content here, it may sound a little legal or legalistic, and I just want to make sure that everybody knows that myself and our guest speaker, we're not offering legal advice. We're just offering you some information that you may want to think about moving along, and we can talk about what that means and what it doesn't mean throughout the sessions. If we go to the next slide, it's my pleasure to introduce the key speaker for today, Carol Pivosin. Carol's been instrumental in the design of our toolkit. She's got this incredible experience moving through it, and she'll be our keynote speaker for all of our webinars coming up. So without further ado, let me turn it over to Carol. And Carol, take it away and welcome.
Thank you so much. Thank you everybody for joining us today. And thank you to Infoway for putting on not only the toolkit, but also this webinar series. The time could not be better to look at, think about, plan for, invest in advanced technologies in healthcare. The COVID-19 pandemic has accelerated the digitization of health data and has given new opportunity to consider what to do with that data and how to mobilize that data for a broader social benefit. So the toolkit really comes at a great time where Canadians, but also what we see happening around the world in the US, in the UK, various countries throughout Europe and beyond, investing in digital health and investing in sort of advanced analytics and artificial intelligence for better healthcare, recognizing that really, good health services and healthcare providers, healthcare delivery needs to sort of move into the 21st century in the digital era and catch up with the rest of the way we live, frankly. So what you'll see throughout the 5-part series is practical guidance as it stands today. So really trying to help organizations that are in the healthcare delivery sector to move into experimentation and ultimately implementation, moving from idea all the way through to actual operationalization of systems in a manner that is responsible, safe, and consistent. So you will see various questions that are provoked throughout today's webinar and throughout the series up until March 3rd, where we're really trying to think about, well, what is AI in healthcare? What does it look like? What do Canadians want? How can we mobilize what is so unique about our health system for the benefit of Canadians? And then what can the world learn from us, given how much we are doing already in healthcare, how much policy work has gone into healthcare and AI, how much legislative change we see on the horizon and we see in the works already, how much investment has been made in research and development, the incredible research talent that we have in Canada for AI and healthcare, and then ultimately some really deep commercialization of good healthcare products that offer and that rely upon or are enabled by AI technologies. So that really speaks to sort of part 1 of the roadmap. But all of this, as exciting as it is, as Brad said, it does come with some significant risks. We need to understand those risks and walk in with our eyes wide open. And so really starting to unpack what are some of the risks that we see out there, what is unique about artificial intelligence in the health sector, and what are some of the strategies to mitigate those risks. That will be covered throughout the course of the webinar series as well. Again, looking at some of the emerging regulation as it speaks to specifically artificial intelligence, but also as it touches on what I like to call as sort of proxy regulation for AI, legislation governing the use of personal information, personal health information, that we'll be looking at in a little more detail during a later module. And then getting to practical strategies. So how do we identify strategic opportunities within a healthcare organization, within a regional hospital? We're not talking, it doesn't necessarily need to be a large research hospital, but what about a smaller community hospital? What are some of the strategies that we can put in place to begin the discussion if it hasn't started yet, or begin the investment and the experimentation with some of the data in a responsible manner, moving through to actually operationalizing value add technologies that are enabled by artificial intelligence, and then being able to demonstrate the success of those technologies, both from an administrative efficiency perspective, but also from a patient care perspective. And then what does some of that governance look like? So we know that we've got great possibility. There are significant risks that do present as we roll out these data-rich technologies. So what types of governance structures do we need to put in place that aren't there already? And what I'd like to just underscore there is that there are a number of existing data governance processes that you would have had that you have in place within your organization. And what we want to really be doing is thinking about how do we augment those existing structures? So that's sort of a précis of what you're going to get over the next 5 weeks as we meet every week for about an hour to discuss different issues that come up in the toolkit. We really encourage you to read the module and then attend the webinar. Ideally, you're not only just reading the module, but you're having internal discussions about it so that you can bring some of that learning to the webinar. These are intended to be interactive, though we recognize there are a number of people who are joining us. We do want to solicit that feedback. And throughout the course of the webinar series, if an idea percolates or pops up in your head, or you've got a great example that you want to share, we really encourage you to reach out and share it with InfoA today. The email address that will appear in the chat or in the Q&A later, it's innovation@infoway-inforoute.ca. So really, like, this is supposed to be a working session that allows us to work through some of the practical guidance that we have in the toolkit, and then allow it to apply to your particular context. So module 1, as Brad said, is a survey of sorts. It's really supposed to be a level setting, an introduction to artificial intelligence in the healthcare sector in Canada. This is a made for Canada type toolkit. I would argue that there are many of the lessons that apply internationally, but this particular toolkit looks specifically at Canadian examples to highlight and really celebrate those examples of how Canadians are investing in, and the Canadian health sector is investing in, a more efficient system going forward. So we're going to start with module 1 to level set, explain what artificial intelligence is generally, and then discuss some Canadian use cases, again, to situate all of these great ideas in the Canadian context, in particular, coast to coast. The audience is really intended to be broad. So something to just pay attention to as you look at the different modules of the toolkit. The first or second page typically will indicate who the intended audience is, and we've done that quite intentionally. In some cases, the module is intended for a very broad audience. It doesn't really matter who within the organization, the healthcare organization, is reading this. It is intended for a broad consumption. In other cases, it may get actually a little more technical, whether legally technical or more strategic and governance focused, in which case we do suggest who we're speaking to. So this is, there are some modules that are speaking mainly to administrators, for instance, because that would be one of the target audiences for that particular module. So just pay attention to that, not because it should exclude you in any way if you don't fall within that category, but just so you can understand the tone better of that particular module as you go through it, really internalizing how you're intending to read it and what the perspective is really trying to share. The objective of this particular module is to introduce some basic concepts and to start making this very ubiquitous world of artificial intelligence feel a little more tangible, so that we move from big ideas, big theory, big, concepts to something that feels something like you can hold in your hand and sort of touch. So I'm going to move a little bit into framing, how do we frame this conversation? Since this is an introductory level setting module, what is the overarching objective of the conversation that InfoWay is leading? And we've defined a few questions that guide that particular conversation. So the first is really to step back and let's just think about what is best for us. So first of all, when Canadians look at the healthcare system, recognizing it's very different from jurisdiction to jurisdiction, I totally appreciate that. But wherever you are, as you look at the delivery models that are in your particular jurisdiction, do you feel like we're at the best it can be? Where are there opportunities for improvement? What do those improvements look like? What are some of the strengths of our existing systems? And where are there significant gaps in particular? And then importantly, what do we think is needed to fill those gaps? So I just want to be clear about one thing. The suggestion here throughout the module is not that artificial intelligence is the be all and end all solution for all problems, not at all. It's really to help think about and think strategically about the various tools that can be at your disposal as you problem solve specific systemic or delivery problems. So we are, introducing some tools, some ideas, some mechanisms, some programs to think through what your problem solution dynamic can look like. But it's certainly not to suggest that artificial intelligence will solve all problems. That's not where we're going, or that you should be, using artificial intelligence at all costs because it is the thing du jour. Also not where we're going. It really is to help frame the conversation, contextualize the opportunity, and then give you practical tools to think about where it may fit and how it could potentially help. So that's part of the framing the conversation bit, but also looking through it the eyes of the patient. Where are there opportunities to augment patient care, really augment the delivery experience, augment the patient experience with the health sector. We'll look at a few examples of how there are robots in particular that are enabled by AI software, how that could be one potential opportunity, though again, not the only opportunity. We'll look at some examples there. What do Canadians want? So as you are conducting any stakeholder analysis or stakeholder engagement opportunities, to really ask questions around how could we make your experience better, and what are some of the tools that you think would be more valuable to you as you engage with our health sector. And then importantly, within an organization, which is so critical, particularly at a time like this where our health systems are absolutely taxed, to think and start planning for opportunities to create greater efficiencies and to move from idea to implementation, which is really hard to do. But as a bit of a spoiler alert, it's particularly difficult where you're talking about mobilizing sensitive health data for the purposes of a broader analytics tool. So there is a lot of work that goes into the early parts, forget even getting to the point of artificial intelligence, but just understanding what is the data that we have, where is it located, who has access to it, how reliable is it, what are deficiencies in the data sets that we have, and then we can start planning what are some of the projects that we want to be doing. But that data quality piece is extremely important and takes a lot of time. Okay, so let's go to, as a lawyer, I always like definitions. I like to put things into boxes and make it work really well. So I love definitions, but I will tell you that the term artificial intelligence does not lend to a consensus definition. So we are, doing our best to rely on some of the heavyweights to help give us guidance in terms of what the umbrella term artificial intelligence means, but there is no strong consensus definition that you will find out there, which again, for me, makes it always really uncomfortable, but we're gonna work with what we've got. So we're drawing from the AI for Health Task Force, a task force that was led in part by the Canadian Institute for Advanced Research. The report titled Building a Learning Health System for Canadians, report of the Artificial Intelligence for Health Task Force. This is from 2020. And the definition that is proposed there is any current or future machine learning approach to predictive analytics, decision support systems, and or automated decision making. Okay, but seriously, like what is it? So let's look at artificial intelligence from the lens of an example. I always find that helps me make it a little bit more tangible than just broad scopes. So when we're talking about artificial intelligence, as I had already suggested, we're talking about an umbrella term. And when we look at examples of that umbrella term, we reference often machine learning capabilities. We may reference natural language processing. We may reference computer vision. These are examples or subset applications or subsets of artificial intelligence that lend to what the overarching umbrella term is intended to suggest, which I always think of as, well, can we make machines intelligent? And that's sort of drawing from Dr. Alan Turing back in the 1950s. But can we find machines that are, or can we help make machines more intelligent, arguably a little more intuitive? So machine learning in itself is a set of algorithmic techniques where the machine effectively teaches itself, or it learns without necessarily being explicitly programmed to do so. It's exposed to large data sets and it's learning from the data. There are different ways this is done. There are different training methodologies, but at a high level, that's what we're looking at. And the example that we drew for to help, again, make the example of machine learning a little bit more tangible is Unity Health in Toronto that is using artificial intelligence to recognize patterns in the emergency room traffic to manage staffing levels and triage acute patient care in the ER. So really using the flow of data to understand where are there peaks in ER traffic, what does the staffing need to look like, where are there typically dips in that traffic, so you don't necessarily need to have the same level of staff on hand, and then how can we triage acute care better to make the emergency room experience a little bit more fluid and to reduce wait times. So that's one example. If you have another example, please put it in the chat or put it in the Q&A, or please send it into InfoA, because we'd love to hear what that example is. We know this is just one. Natural language processing is really that ability to understand text, whether written or oral. And, you know, I said text, actually. It's an ability to understand language, whether written or oral. And language is so contextual that really trying to understand and interpret language can be extremely complicated. And we all know this when we learn a new language, trying to make sense of that nuance is really challenging. So that's very much what you're seeing in more advanced NLP, where they're not only understanding letters and words put together, but in trying to understand that context as well. So we've got the example out of Eastern Health in Newfoundland and Labrador, where there were some really interesting investments made in a chatbot, a virtual assistant actually, named Eva. And Eva was really informative at triaging mental health resources for staff at Eastern Health. And we had the opportunity to speak to the sort of initiator of Eva and really understand the process. It's fascinating to see how much investment is made to create such a system, but also how much benefit is derived, particularly as the system becomes smarter over time. There's also machine learning, computer vision capabilities, which is that ability to correctly label images. Also very difficult when you think about how, you know, just the slightest obfuscation of an image can really make it complicated to determine, but also how many different words we use to label particular objects in our surroundings. But that's where computer vision is going. And we have a great example out of Saskatchewan Health Authority that's adopted technology to diagnose lung abnormalities in chest x-rays associated with the COVID-19 pandemic. So those are some examples of what artificial intelligence is. There are many more. And again, we'd love to hear from you if you have particular examples from your organization. So let's keep drilling down on this theme of examples. AI is being used in healthcare today. This is not something that's happening in the future. This isn't, I mean, it is happening in the future, but it's not far off. We're not talking about, you know, AI of the future per se. We're actually looking at what is happening in our health systems today. What are our hospitals using today? What are clinicians using today to facilitate and augment that patient experience, and also to facilitate and augment the administration of health systems? So what we've done is sort of categorized two components to how AI is being used in health today. The first is really looking at some of those applications that touch on system efficiencies and sort of contrast that to an extent with systems that are used to better patient outcomes. So in the delivery of healthcare specifically. And while the two, of course, are naturally connected, I would argue that the example of Unity is an example of a system efficiency, even though it ultimately also has an impact on better patient outcome. Whereas other examples that we'll see in clinical applications, in research and development, detection, diagnosis, they are specifically intended to immediately as the end user to improve that patient outcome. And so these are examples, again, not exhaustive. So where you've got other examples that you'd love to add to a version 2.0 of this toolkit, which is would be a wonderful thing to see, we'd love to hear those examples. When we're talking about system efficiency, so let's drill down on that first point a little bit and give a little bit more context for why this is such a pressing need, why it's being invested, AI is being invested in these particular applications today, and what are the implications. So we've seen various reports that talk about, and it's no surprise to anybody, that hospitals are spending quite a large amount on administrative services, or a relatively large amount on administrative services, and that hospitals are looking for ways to maximize efficiencies in the delivery of healthcare services and in the overall administration of the system itself. One particular study found that the inefficiency gap in Canadian healthcare has been estimated at between 18 and 35%. So what does this mean? It means that there may be redundancies in testing, delayed or misdiagnosis, lack of preventative care, and there may be other systemic issues. As I said, having, the system efficiency component really tied ultimately to better patient care. So with that, when we're thinking about what makes a good AI project, if you will, I use that term a little loosely, but just if we were to play around with some ideas for a moment, what would make for a good AI project? Well, I think the first thing we're trying to do is identify a persistent problem that has that doesn't have too many variables to solve it. So what is there? Is there a routine task or a routine activity that somebody or a group of people are undertaking that actually could lend themselves quite well, or lend itself quite well to a form of automation? And then take that as the starting point and look at what that automation could look like and how you could build upon that automation in a smarter way. It's a good place to start as you try to think through opportunities for more advanced technology, and as you build out that technology portfolio. So here are some examples of how artificial intelligence can help with system efficiencies. And we again draw from various examples that we found either through some discussions or simply through online searching. The automation of basic tasks and timely follow-up on laboratory or other patient records. This is an area where there is some substantial liability, where a patient record isn't properly followed up upon, and then that could result in a delayed diagnosis. So really finding an opportunity there to close that gap and identify it as a pain point at first instance, and then close the gap. It may be, as we saw in the Unity Health, a way to facilitate, expedite patient admission and discharge processes that can be a real friction point for patients in their healthcare experience. It could be a way to better identify traffic patterns throughout the hospital, and then identify where resources could be better allocated to facilitate and manage that flow more appropriately. And then, of course, it could be through the digital recording, and ultimately processing of clinical notes. So these are some very, I would say, lower level examples of how AI could be used. There are much more sophisticated examples out there. One example that we really liked was out of Humber River Hospital, that's using the robot Pepper to greet patients as they come into the hospital and to help direct them to the appropriate wherever they're trying to go. There's a conversation to be had there. Is it nicer to be greeted by a cute little robot, or is it nicer to be greeted by another human being, particularly if you're in a period of distress? Maybe the robot's not exactly what you want. So certainly there's a conversation, but it's a great example of an effort to, for those who are open to speaking to the robot, maybe not in distress, there may be humans around, but for those who are really just looking for some direction, they can go to Pepper, have a quick convo, and off they go to wherever they need to be. The other example is the use of robots for delivery within the hospital. This is actually proven to save quite a bit of time when instead of having an individual run from one part of the hospital to another to deliver, whether it's some kind of medical instrument or need, that you would have a robot do that instead. Now, of course, you need to make sure there's tracking so it doesn't get lost, but you can see opportunities to experiment, and that's really where we're at. When we talk about, so now moving over to the other side of the initial slide, where we're no longer talking strictly about hospital administration efficiencies, but now we're focusing a little bit more on some of those specific patient outcome benefits. We see that there is greater investment and adoption of clinical applications of artificial intelligence. And again, this is an opportunity to identify any type of pain points that may result in the patient either having to wait longer or not getting the type of service that they should expect from our systems. Maybe it's not the same level of accuracy that they would expect of a particular finding. So really trying to identify how can we do something better and what would it take for that thing to actually materialize. Some examples that we pulled out here, one from Saskatoon Health Region that adopted a robot by the name of Patrick that connects patients to specialists via video link. So again, I can anticipate questions being around, is this really AI? What is the AI component? And I think those are all valid questions. From my perspective, what I'm hoping we're doing is stimulating some ideas by showing examples of how advanced technologies are being used in different contexts. And certainly the collection of that data that's coming through the various contexts, of course, depending on what all of that looks like, the collection of that data can result in other elements or other applications that feed that same problem, or that sort of solve that same problem with a more advanced solution. So again, the idea is very much to stimulate conversation, stimulate thinking about, well, what's happening in different hospitals across Canada, big, small, community research. What are we seeing in the use of more advanced technology? So Patrick is a robot that makes this connection, but it also can do some point of care diagnostic work. So this is, to me, where it becomes a little bit more interesting, where it may be able to immediately connect to different scopes and ultrasound machines, and the specialists that may be miles away can provide that support and can provide that expertise. So you've got two phases to the Patrick robot that can be quite helpful, particularly in the rural context. We've seen healthcare organizations in British Columbia using telehealth applications to allow users to describe some of their symptoms to a bot and then facilitate a video consult with a healthcare practitioner. So again, making that connection between patient and healthcare professional a little bit easier, and creating different mechanisms, different instruments to facilitate that connection and that consultation. Some examples, again, out of British Columbia. And then looking at Vancouver General Hospital and St. Joseph's Healthcare in Hamilton, those are two examples of Canadian hospitals that are using surgical robots. And when looking at some of the feedback on the surgical robots, at least what was reported, not speaking to the veracity of those reports necessarily, but really finding that there is an enhanced accuracy and a much more fluid use of these robots in the surgical context that was actually found by the surgeons to be a value add. So something to explore if this could be interesting in your context as well. I see that there are a few questions in the Q&A. I'm going to hold off till the end if that's okay. Particularly because this particular presentation is a little shorter than the next. So I'd love to just run through these and then we'll get to the questions at the end. In detection and diagnosis, so we see actually a lot happening in this space with artificial intelligence, and it ranges from almost the commercial through to the much more advanced and the more focused on the health delivery systems. And so what we're finding, the example in McGill is a great example of a machine learning tool to help predict head and neck squamous cell carcinoma. We see the same types of computer vision technologies that are being used to identify if a mole is cancerous, is malignant. So we've seen, and some of that actually is quite commercial. I haven't seen it fully rolled out to end user, like a B2C context necessarily, but it is becoming more and more commercialized, where we're having new entrants to health or private sector organizations often tech companies that have really landed on a particular technology, selling direct to consumers. This will be an area to watch. We've seen some reform in Ontario privacy health law. We've seen some in Quebec as well. And actually, coast to coast, we're seeing more and more discussion in this respect. How do we handle, what do we do about new entrants to the health sector? What does it look like to regulate those industries? How are our end users put on notice of what that relationship looks like? But we are seeing a number of really interesting applications come out in this space. Sometimes, as I said, sold directly to the consumer. We're not seeing that quite as much yet. But at least not in the detection space quite as yet, but certainly being sold through to hospitals and clinicians directly. We also have some examples of how artificial intelligence is being used to detect coronary disease by tracking heartbeats. It's being used to detect rare and specialty diseases as well and this is actually done at the point of care, the first point of care environment, where clinicians are using artificial intelligence to scan a patient record against a set of criteria that would indicate a potentially rare or specialty disease, and then flag for that clinician whether in fact the patient should be followed up upon for that particular condition. So not being deterministic in any way, but certainly giving the clinician a sense of whether there are more investigations that are needed for that particular patient. And from the patient's perspective, narrowing the time, narrowing the number of consultations that may be needed to get to an appropriate and proper diagnosis. So those are some examples in detection and diagnosis, and I will repeat myself like a broken record. If you have a great example, we'd love to hear from you. Medical research and development, there is a ton happening in this space. And I have to say, as a proud Canadian, this is one of the areas that makes me almost the proudest. Because we have really deep talent coast to coast in AI research that are specifically focused on research and development in the health sector. We also have some really interesting things happening in the private sector as well, where we're looking at new medical devices, new therapeutics, new drug discovery. The Health Canada came out with new guidance on software as a medical device that particularly touches on elements of artificial intelligence. We see that out of the FDA in the US as well, and out of Europe too. So, how artificial intelligence is being used to actually facilitate or expedite medical discoveries and medical research is a very rich area for further investments. Certainly, it will not only lead arguably to better outcomes from the research community, but ideally down the line, better applications for better patient outcome. So an enormous amount being done in that respect too. Now, with that, I will close just to say, first of all, thank you for participating. I'm looking forward to the questions that are coming, but also just to bear in mind that there are the 4 other webinars that are coming up, where we're going to dig a little bit deeper into questions of what does AI governance look like? What does emerging regulation look like? How do we strategically identify opportunities within our organization to further experiment and actually to create these examples that no doubt you'd want to share with InfoWay. Thank you.
Okay. Hey, Carol, that was great and generated lots of questions, and we're going to try to tackle them. Maybe couple in groups, one by one. I'll let you get your breath there for a second. So first of all, thanks to everyone for the questions in the Q&A. Also a couple of questions, comments in the chat, and we're going to do our best to try to get through them all. Let me start by saying InfoWay's journey on artificial intelligence in healthcare really came from a conversation that we had and a set of readings and a bunch of discussions with an organization called CFAR, the Canadian Institute for Advanced Research. And in July of 2020, and Carol mentioned this earlier, they formed a really interesting task force about some of the challenges related to AI in healthcare in Canada. And it was from that challenge that the AI for Health Task Force put out. InfoWay thought there might be room to do something very specific. And what we thought that specific thing was to develop a toolkit focused on healthcare delivery organizations, whether it was a hospital, a clinic, a long-term care situation, likely a bunch of variations. So first of all, groups that are delivering primary care or health care directly to patients. That's the first part. The second part, that they were focused on implementation, not on doing research, not on doing development. It was really, we were thinking about, you know, the middle class of hospitals, all the clinics that are across the country. How do you go about implementing this? And we're thinking about project teams, the types of questions that were being answered. So it's a very specific focus. If you think about a group like CFAR, Vector, Mila, Amy, these artificial intelligence groups across the country, they're doing great research. They tend to team up with local, world-class universities to do their research, community and health. They're doing development of software applications. We're not directly targeting that group either. We're really thinking about the groups that maybe aren't associated with a research group or with a university, with the groups that aren't developing their own software but are using more off-the-shelf AI applications. And what are they going to do, and how can we make it more comfortable, and what are the questions that they need to ask? So that's where we're trying to get to with the toolkit. I think that helps frame it out. Now, what it does mean is that this is not toolkit for everybody in every situation. That's number one. Number two, we've tried to give in this webinar just examples of how AI is being used in healthcare. And I'm not sure that we're advocating for any particular type of implementation, but we're saying this is what's happening. And what we want to do in the subsequent webinars is we want to say, here are the things you should begin looking about, because there's always room for improvement. So that's the start of it. But let's just start with the questions here, Carol, and I may ask you one or two as we're going along. And we're going to let I'm going to let the first question get the asked is going to be the first question I'm going to ask you, and it's from Kevin Willison. Do you envision AI enhancing collaborations and integration of the social sciences with that of health sciences? So he's really combining our focus on healthcare with other areas related to social sciences, and how might those work together. And it's a kind of one of these kind of little brainstorming questions about how it might work there. What are your thoughts there, Carol?
Yeah, I think it's an amazing question, to be honest. So I'm going to give you an example from my own experience. Right now, we're working actually with a U.S. Health provider to build out their AI governance program. And one of the interesting topics that we've come across is, well, what do you do with various data sources? We've got ton of internal data sources, but we're also being pressed to get external or other data sources and other data points to really broaden beyond what is traditionally considered health data to including social determinants of health, and what are the implications there. So when you're thinking about artificial intelligence, and that's a topic that we're working through from a governance perspective. So what are the controls that need to be put in place? What are the ethical questions we need to answer? How do we have to document those questions? What justification are we going to give to the answers? So really, it's not a simple, straightforward answer, because it's a dynamic process to really understand that the implications of that data. And frankly, from my perspective, it's always, okay, you're collecting the data for this particular purpose. And remember, that's the only purpose for which you're allowed to use it. But I worry that you're going to get excited, like the organization down the line will forget about the purpose for which it collected it. And will get excited about the concept of being able to collect SDOH data and then want to do more of it and use it for other reasons. And have you thought that far along? Like, have you really given context and thought about what are the social implications of artificial intelligence and the use of all of those different data sets for a particular output? So something that I really value that CFAR did, they're not alone. This is actually happening across most of the research institutes. It's happening in many different sort of sectors that are looking at artificial intelligence, is we're looking at the governance of AI from a societal perspective. So you'll see a lot of AI in society trying to connect dots between what does it mean for this technology to live in our society, who gets to drive the development of this technology, who puts in place the right parameters to make sure it's not used for an inappropriate purpose, what questions are being thought of, like who's at the table asking these questions. Going back to the task force, Brad, that you referenced, sitting around that table, We had, so I was on that task force. We had lawyer, VC, we had health professionals, we had health administrators, we had researchers. So it was more of a multidisciplinary team sitting down and thinking, okay, well, what is this going to look like? What does it look like to actually propose a good framework or some good recommendations? I wouldn't say framework, but good recommendations for AI in the health sector in Canada. So I hope I've answered the question, but I think it's a really important question. It's, my own view, and it's something I advocate often, is we're not just talking about a technology. We are talking about the use of a tool, a really persuasive, increasingly powerful tool by individual humans, by us, for our purposes. So we need to define what that looks like in society and make sure it aligns with our values. It doesn't subvert it.
Great, Carol, thanks. So another question, actually a series of questions, and partly it has to do with data repositories. A question from Stephen. There's a version of it from Jim Parsons. He's talked about ethics and how data is used, and one from Anonymous. And let me just phrase the question. I've just put a link in on this AI for Healthcare Task Force. And one of the things they mentioned that we need to spend time on is a data infrastructure approach for the country. Now, Infoway is not taking that on. That's a very complex jurisdictional approach, but there's many elements to this. The idea that AI feeds on more data, I mean, that's generally accepted, maybe not always true, but how do we put ourselves in a position where we can take advantage of that? The other part of this, and I'll put a link in a little bit later, is what do Canadians expect? Canadians have a very high level of expectation, but what we do with their personal health information. And I'll put a link in just a second from an annual survey that Infoway runs with 12,000 Canadians that we've been running for about a decade. For the first year, we began to put some innovative technologies and AI questions in. And in summary, and I'll show you I'll send the link and you'll see the data and you can look at it yourself. Canadians want to be able to contribute to AI research in healthcare. Almost 69% of Canadians said that was something they really wanted to do, or they were willing to do if there was informed consent. And almost 50% said they would still contribute data even without informed consent. There's likely some good questions about how well these questions are defined and what it actually looks like. But there's a real expectation that Canadians have is they want to be able to do world-class research on it. So I'm kind of combining two things: bundles of data, expectations of Canadians, how do we look at it from a privacy and from an ethics perspective. I know you're going to cover a lot of this in our second session coming up next time around, but maybe you can give us a little bit more detail while I track down that link.
Yeah, absolutely. So I was involved in the federal government's consultations on the digital charter. This is going back to 2018. And one of the key points we heard across Canada was that we need to think about how to better harmonize data, not mobilize it into a repository. So not contemplating what effectively Newfoundland Labrador has, which is a central data source, but that we needed to just, at the very least, harmonize the way we label data and structure data so that, when we need to or we want to mobilize large data sets, we're able to do so. Our systems really aren't structured that way. So we have a federation where health delivery is it's provincially governed. And trying to mobilize that data is as much a political problem. Actually, it's more of a political problem than it is a technical problem. We could probably technologically do it very simply, but to do this from a political perspective is much more complicated. So we have a policy discussion here, and it's one that's been raging in Canada for a very long time, which is, we understand that there could be a social benefit to the consolidation of huge data sets. We actually do have, in various provinces, we have large data repositories. You're just not allowed using those data repositories in the manner that health researchers wish they could, or AI health researchers in particular. So, and that's defined by legislation. So the legislation defines how you can use those large repositories. So that's a political and policy discussion that we have to have. And we have to agree first of all, we have to decide, do we agree that having access to cross-Canada data is a good idea? And I think that's a debate to be had. So I can give you my personal opinion, but I don't think that's what you're in for. Then we have to decide what is the safest way to do that. And then we have to decide who gets access to it, under what conditions. And we have a whole flow of questions that come there. So what I can tell you is the Digital Health Discovery Platform is one example, DHDP is one example of a multi-stakeholder initiative that is trying to connect data across different health entities, across different jurisdictions, for the purposes of better research in cancer and in neurodegenerative diseases. So that's an example where federated learning models are being used. So nodes are being placed in data sets across Canada that are agreeing to participate. And there's a whole governance structure that we're currently developing to help facilitate what that should look like and how it can be done in a safe manner. If you're speaking to an AI health researcher, they'll tell you it is the imperative. It is what we need to do. But there are lots of other voices that don't quite agree with that. So we need to find a way to have a proactive conversation that effectively balances the social benefit of that research with the concern, the risks, and the other, I think, valid points that are raised with respect to how you properly govern and circumvent unauthorized access to some of those data sets, and you properly govern the use of that data. So that answers the first question, and it's not a great answer. Okay. I appreciate that. It's sort of, the answer is effectively, yeah, there's a lot to be discussed and let's figure it out. But the reality is that's a little bit of where we are right now, just speaking very practically, like just being totally plain. We are in a world where we have the technological means. We need sufficient political will to mobilize.
Great. Well, look, and more on this next week's webinar, specifically on that topic, regulations and approaches, and what we should be thinking of. There were two questions, one from Clark and another one from Mark, one in the chat and one in the Q&A about AI and the delivery of community-based care. And I think it's a kind of a primary-based care. And we may have used a lot of hospital examples, but we were certainly trying to be inclusive of healthcare delivery, hospitals, clinics, long-term care. But I think it's fair to say we're likely looking for as many examples as we can find in these clinical worlds, and we'd like to understand that. We're also thinking about a clinic, and we may all have in our mind the idea of what a clinic is, but how does a clinic go about implementing an artificial intelligence solution in their world? And Carol, would you say what would the differences might be between a hospital implementation starting their journey and a clinic starting their journey? What might we want to tease out of that?
Well, so we gave one example of primary care clinical use, and that was in the context of the rare diseases. So that is very much community. Sorry about that. That's very much primary care. That's the word I'm looking for. It's very much a primary care example where it is your GP that will have access to this technology that will allow for the scanning of health data against a set of criteria to flag the potential risk, that a person has a particular rare or specialty condition. Okay, that's just one example that I can share with you. And the reason I share that example is because it's happening in physician offices as we all go to our GPs. That's something that could be accessed by us as patients if our GP chooses to have access to that technology. So the question that you raised, though, Brad, is, well, what's the distinction between what we're seeing in GP offices, for example, as an example, or what we're seeing in hospitals? Well, I think there was another comment made, I think, in the chat regarding what role do vendors play? Are you just getting sort of a best-in-class application, or, is the idea that you're co-creating a type of application? And I think what we're finding is the clinical use cases in primary care are typically that relationship with a vendor, where you're looking for a vendor that has the type of technology you want for your patient population, and you're accessing that technology in a way that is careful, because you are the health information custodian if you're located in Ontario, for example. So you are, or just the custodian if you're in other jurisdictions. So you are the one that's responsible for that data. So you have to make sure that you are confident and comfortable with how that data is being used. But there is that relationship that's already being formed, and it's being formed right there in community offices.
Right.
It does require a degree of sophistication on the part of our physicians, right? So it does require our physicians to understand artificial intelligence technologies, and importantly, understand the strengths and the weaknesses of the outputs. So there's an education component that's needed there. The vendor may provide that education or not. And if not, then it really is, and I would say either way, it really is on the physician to better understand how this tool can be used in a responsible manner.
Right.
But it's certainly our primary care physicians and healthcare professionals are investing in these technologies now, recognizing that, I mean, frankly, it can serve a number of different benefits, potentially also limiting certain areas of liability, again, depending on what the application is doing.
One of the things, and we're running out of time here, we're not going to get all the questions, and I'm sure people are, some at least, are unsatisfied with how much we've been able to answer in detail. What I want to do is put a little bit more context on this. A lot of our scenarios, imagine if you were in a hospital and you were running a privacy review, a security assessment, a risk assessment. What are the things that you want to add to your approach, the things that are already in place in a hospital? If you're in a clinic, we've got some really good checklists and guidelines. Imagining that you're a physician and you're sitting down with a patient, how do you approach algorithmic explainability? When you say, hey, you know, our assisted artificial intelligence solution says X and Y, how do you get yourself prepared to answer that question? If you're sitting with a vendor and you're thinking about choosing their solution, what questions do you ask them about where does their data come from? How does it fit? How is it sourced? How does it fit there? So we're trying to give some really practical approaches to these things. Again, it's just a start. You know, every clinic, every hospital does this a little differently. But going forward over the next month or so, take time to attend the webinars, have a look at the toolkits. I'm sure we're going to answer a few questions and then raise a few more, and we'll do our best to get there. I put my name and email in the chat. Feel free to follow up with any of those. And some people I want to follow up with directly, because I know we didn't get to your questions. We're basically out of time now. If we can move to the next slide, the final slide. This is our webinar schedule coming up. This is the link for our toolkit. I want to thank you for attending today. And, you know, apologies to the questions we didn't get to. I thought there was a chance we could get to them all, but we couldn't. But we're going to write them all down, and we're going to do our best to try to follow up as we go through this. So thanks a lot, and carry on with your day. And hopefully you were all able to have a bite of lunch or something as well as we were going through it. Carol, thank you very much.
Thank you. Thanks, everyone.
Bye-bye.